My name is Dr. Adam Downs. I have been working in the treatment space for almost 20 years now. Most recently, I've been the Chief Clinical Officer for a large treatment provider with multiple locations throughout the Southeast. When making the decision to bring VR into our company and into our process, we had to look at it from multiple lenses. We had to look at it like, clinically, is it sound? Is it fit within our clinical model? And will it work within the way that we provide treatment? The other thing we had to look at it, did it make financial sense to make this investment? One, we felt that it was a distinction that we were progressive in our approach, that we embraced technology and that we embraced cutting-edge treatment styles, and that it was important for us to be able to offer and deliver treatment and clinical interventions in multiple modalities. And I think that could separate you from some of your competition. The other thing that we looked at was one of the biggest negative impacts financially on any treatment program is when patients leave AMA, or against medical advice. What the research shows is that the more a patient is engaged in the treatment process, the more that they're applying the skills that they're learning in treatment, the less likely they are to leave treatment early. Especially in those first, that first week, when they're so uncomfortable and they're feeling bad, withdrawals, they're scared, they're homesick, you name it, fill in the blank here. The VR was able to teach them skills in which they could apply even when not directly in the program. Like, these were skills they could wake up at 2 o'clock in the morning and remember from their VR session the day before, breathing techniques, ways to meditate. We found that we wanted to be sure we let everybody know before they even got there, that this was going to be a part of their process. We wanted, at conferences and at speaking engagements and just any type of marketing, we wanted to let other people in the field and other potential customers and referral sources know this is what we're doing. It's what do we provide that is interesting to the patient. Often they can see like, oh, there's VR sessions, or, wow, you're using, technology. That's pretty cool. Like, you've piqued my interest, right? And there's not a lot about treatment that piques the interest of a person in active addiction. Having the VR as an option can give the patients a sense of relief that this isn't just going to be some type of invasive, boring, difficult process. And that in and of itself provides hope for the patient. One of my favorite stories to tell about how powerful the VR can be is we had a young man who had been in treatment for just over a week. He was experiencing cravings, and there were some things going on at home he felt like he had to get back to. And the combination of the anxiety, the fear and the concern about what was going on outside of treatment, plus the cravings, was just a recipe where he was done. He was definitely not ready to leave treatment. He had not completed his treatment plan. And so as he was kind of explaining to us that he was gonna leave, our team was able to sit down with him and say, hey, why don't we do one of your VR sessions? He started the VR session, went through the entire process. When he took the glasses off, it was visibly very different. Much, much calmer. The shaking had stopped. His cravings had gone away. Once that session was over, he went back to group and finished the day, and then ended up staying and completing his whole stay at treatment. And we saw that happen multiple times a week. It was just very exciting. If you're skeptical about kind of taking that leap or that journey into using behavior, my biggest piece of advice to you is if you experience the demos and see kind of what it is that's being offered in the program, and then put yourself into the situation that your patients are in. You know, put yourself in a situation where your life is literally fallen or falling apart. And then imagine having the opportunity to do something that's cutting edge, that's groundbreaking, that's proven to be successful. And think about how important that can help them feel. To know that the place where they're receiving their care is invested in their outcomes. And I think if you really think about your patients and about the opportunity that this gives them, it's an easy decision to make.